What is the current state of healthcare in India?
Well, the government has obviously done a lot of stuff in terms of trying to democratize healthcare. They've got a new platform for the average Joe on the street to get a minimum cover of 5 lakh rupees, which means people who are actually not attending to themselves are now starting to attend to themselves. That throws a domino effect of companies which are providing services, manufacturing products, etc. And all of that requires size and scale for which capital is required. And that's where people like us come in. And apart from the fact that there is a lot of fantastic, innovative stuff going on in healthcare.
How has India's healthcare industry evolved?
Healthcare 1.0 in India was Indian manufacturing companies copying the drugs which were going off patent in the US. It was essentially new kind of chemistry. So you put in a bunch of stuff, produce a new drug. It didn't require too much of I would say technical expertise. That's why a lot of people could do it. Many of the very large companies today have built their business on the back of that, which was essentially cost competitiveness and reverse engineering of products. Now we are in healthcare 2.0, where we are now seeing companies which are creating new, what we call as new drug entities. And that requires a far greater degree of commitment and intellectual capital. It also means that it has a higher rate of failure. But the good news is that capital is today available to support those kind of ventures. And hopefully the next blockbuster drug in the world will come out of India.
What are Kotak's top investments in this sector?
To us, I would say the best bet would possibly be yet to be seen in terms of the kind of companies that we are investing in, which are early stage companies and really solving difficult problems like cancer, for example, or there is a particular disease where people lose eyesight and there's no cure for that, and there are scientists and portfolio companies of ours which are working on finding solutions to that and making some very serious progress.
Which segment would you invest in right now?
I would still put my money on innovative healthcare, like the kind of company that I referred to. And of course, consumers in India are going to become more demanding, and therefore healthcare services is another area where one would certainly put some capital to work.